Today we're going to be doing post-mortem changes, in which we will be doing basics of death, suspended animation, early post-mortem changes, late post-mortem changes, putrefaction and modified versions of putrefaction, and viscera preservation. So starting off by defining death, death is defined as a permanent, irreversible cessation of functions of the or one of the three interlinked systems of the body, which are the nervous system, circulatory system, and respiratory system. These are also called the Bishop's tripod of life. There is no legal definition of death. There are two types of death. We have somatic death and molecular death. Somatic death, we have complete and irreversible stoppage of circulation, respiration, and brain function. Here we have brain death, which is also of three types. We have cortical brain death, brainstem death, and whole brain death, also called as mixed brain death. Cortical brain death is also called cerebral brain death or persistent vegetative state. There is irreversible coma resulting from hypoxic, traumatic, or toxic insult. The brainstem is intact, that is, respiration and cardiac activity continue, and the patient is considered as a living cadaver, that is, he is not dead. Brainstem death, in this, vital centers for respiration, cardiac activity, and ascending reticular pathways are lost. The cerebrum may be intact, but functionally it is cut off. It is recognized in India under Transplantation and Human Organ Act of 1994. Whole brain death, this is also called as mixed brain death. It is a combination of both cortical and brainstem death. It occurs in steps due to anoxia. The cerebral cortex dies first, followed by the midbrain and then the brainstem. Molecular death, this is death of individual cells of different tissues or organs. In the absence of circulation and respiration, cells die at different times depending on the metabolic activity and oxygen availability. WBCs remain capable of movement for up to 12 hours after death, and muscle takes up about 1 to 2 hours for molecular death to occur. This gap is important because in the disposal of a body, the spontaneous muscle movement after somatic death, if seen, may wrongly suggest that the person was disposed prematurely. And for transplantation, the time between somatic and molecular death, organs can still be retrieved for transplantation. This enables cadaveric organ transplantation. Modes of death. The mode is defined as the abnormal physiological state that is pertained at the time of death. We have bi-chart classification, can be remembered by the mnemonic SAC, which stands for syncope, asphyxia, and coma. Syncope is defined as stoppage of heart function, which leads to cessation of circulation. This is leading to loss of consciousness with postural collapse from acute decreased cerebral blood flow. Causes can be vagal inhibition, myocardial infarction, aortic or pulmonary stenosis, pulmonary embolism, cardiac tamponade, anemia, or a blow on epigastrium. Asphyxia. Asphyxia is acute lack of oxygen for metabolism with inability to eliminate excess CO2. Causes of this can be hanging, strangulation, smothering, drowning, choking, or can be caused due to drugs such as opium, carbon monoxide, cyanide, pathological causes such as laryngeal edema, environmental causes such as high altitude or confined space. Coma. This is unconscious state with complete insensibility, that is, there is no response to any stimuli. Causes can be head injury, encephalitis, meningitis, diabetic ketoacidosis, uremic or hepatic coma, intracranial hemorrhage, opium or barbiturate poisoning, alcohol intoxication, or heat stroke. Manner of death. This is the way or design or fashion in which the cause of death comes into being. It is of two types. We have natural deaths and unnatural. Unnatural is further classified into three. We have homicidal, suicidal, or accidental. Suspended animation. This is a state where vital functions are at such a low pitch that they cannot be determined by ordinary clinical examination. Here, circulation and respiration do not completely stop. They are maintained at minimum, and prompt resuscitation can revive the person. We have voluntary suspended animation. This is mainly practiced by yogis. Involuntary suspended animation is when a person lands into a suspended animation involuntarily, spontaneously. We have involuntary causes. We have cataplexy, hysteria, sunstroke, concussion, drowning, electrocution, narcotic poisoning, anesthesia, or frozen coma. Coming to changes in seen after death, we have early changes and we have late changes. Early changes can be seen in the eye. We have algor mortis, livor mortis, and rigor mortis. Late changes seen are putrefaction and autolysis due to lysosomal enzymes and putrefaction due to bacterial enzymes. Thanatology is defined as the study of death, whereas taphonomy is the study of post-mortem resorption of the body. Putrefaction is caused due to bacterial enzymes. The sources can be from the GIT or from the trauma site. It spreads through blood vessels, and the chief agent is Clostridium welchii. And the main enzyme which helps is called lecithinase enzyme. Early changes seen in the eye, in the retina, within a few minutes, we have Kevorkian sign, or also called railroad sign or cattle tracking. This is fragmentation of retinal blood vessels. It is the earliest eye sign visible. It is visible within a few minutes after death. It can be seen on fundoscopy as fragmentation of retinal blood vessels. In the sclera, within 3 to 6 hours, triangular shaped opacities on either side of the cornea, seen as the with the apex pointing towards both medial and lateral canthi. This is called tac noa sclerotica. It is appears at the exposed areas that are exposed to air, called tac noa sclerotica. Algor mortis, which is post-mortem cooling. The most common site for measurement of body temperature is the rectum, whereas the ideal site for measurement of body temperature is the subhepatic space. The nose and lower esophagus are also common sites used. The instrument that is used to measure this temperature is the thermometer or a clinical thermometer. The rate at which the body cools is between 0 0.4 degrees Celsius to 0 0.7 degrees Celsius per hour. The average is between 0 is around 0 0.5 degrees Celsius per hour. There is three phases in which the body core temperature falls. It takes the shape of a sigmoid or inverted S curve shape, as shown here. Algor mortis is the cooling of the body temperature to attain that similar to that of the environment. Postmortem caloricity is where the body remains warm after death due to high body core temperature. The causes are heat stroke, pontine hemorrhage, septicemia, tetanus or strychnine poisoning. Postmortem caloricity is not seen in burns. Next, we have livor mortis, also called hypostasis, sigillation, cogitation. It is defined as bluish discoloration on dependent areas due to hypostasis of the blood due to the force of gravity. As it is position dependent, in supine position, the dependent parts of the body will be the back of the head, chest, legs, and abdomen. Therefore, post-mortem hypostasis will be seen in these parts of the body. In prone position, it will be seen at the front of the head, chest, abdomen, and legs. And in vertical position, a glove and stocking pattern is seen. The onset of post-mortem hypostasis is within 30 minutes, and it is maximum within 6 to 12 hours. It merges with putrefaction color after that. It is not seen when the body is repeatedly moved, when the position is moved several times. For example, in a body flowing in a river, or it's not seen if the death has occurred due to hypovolemic shock. Could be caused due to hemorrhage, or is not seen in person who has either anemia or dark skin color, or due to hypovolemic shock. Fixation. Fixation occurs usually within 6 to 12 hours. Typically, it is approximately 8 hours. Pressing on the fixed hypostasis will not blanch, whereas pressing on the non-fixed hypostasis will lead to blanching. The movement of the body, if movement of the body is done before fixation, the hypostasis will also move. If it is done after fixation, there will be no change in hypostasis. Contact pallor refers to there being pallor in areas with tight contact with the surface. Therefore, there is no staining in areas where there is tight contact with the surface. Depending on some causes of death, there is change in color of post-mortem hypostasis. In cases of carbon monoxide poisoning, the color of post-mortem hypostasis is cherry red color. In cyanide poisoning, it is bright red color. In phosphorus poisoning, it is dark brown. In aniline poisoning, it is deep blue color. Nitrate, it is red brown color. Opium, it is black. Whereas hydrogen sulfide, it is bluish green color. Rigor mortis. Rigor This is defined as the post-mortem stiffening of the body's muscles that begins a few hours after death and disappears as decomposition progresses. It is caused due to chemical changes in the muscle fibers, mainly because the body is no longer able to produce ATP, which is needed for the muscle to relax. It begins within 60 minutes. The muscles become stiff, and due to ATP depletion, which onsets at about 85% of ATP, it is maximum at 15 to 30% of ATP. The rigor mortis is fully developed within 12 hours after death. It stays for 12 hours after that and slowly disappears 12 hours after that. This is also called as march of rigor, where within 12 hours it is developed, and another 12 hours it stays, whereas after another 12 hours it disappears. Rigor mortis is first seen in involuntary muscles and followed by voluntary muscles. And the first site it is seen at is in myocardium. Nisten's rule or Nisten's principle, it states that rigor mortis follows a specific pattern in which it appears and then disappears. It is first seen in the eyelid, neck, jaw, followed by the face, thorax, upper limb, abdomen, lower limb, fingers, and toes. The rule of 12. It appears throughout the body within the first 12 hours. In the next 12 hours, it is fully established, and in the last 12 hours, it disappears. This is also called March of Rigor. Cadaveric spasm, which is not to be confused with rigor mortis, it is instantaneous rigor at the time of death, seen in drowning, electrocuting, or suicidal gunshot. It mimics rigor mortis or heat stiffening burn, cold stiffening, gas stiffening, or cadaveric spasm. Putrefaction is defined as decomposition of the body after death caused due to bacterial action leading to liquefaction of organs and tissues. The features are seen are color change, gas reduction, and liquefaction of tissues. It takes approximately 5 to 10 days. The first site where it is seen internally is the aorta, whereas the first external site where it is seen is the right iliac fossa, seen as greenish discoloration. Time after death, in summer, it is seen earlier within 12 to 18 hours, and winter later within 1 to 2 days. Casper's dictum states that the rates at which putrefaction occurs is different depending on the media of disposal. It states that air is the fastest, followed by water, and followed by earth in a 1 is to 2 is to 8 ratio. The body decomposes twice as fast in water as in earth and putrefies in air roughly 8 times faster than in earth. Marbling is caused due to self-hemoglobin deposition along the vessel walls, and color progresses from greenish to reddish blue. It is seen within 36 to 72 hours of death. Hydrogen sulfide production leads to bloated body. Post-mortem purge is bleeding from nostrils and mouth, and there is blister formation due to gas production. Difference between post-mortem and ante-mortem blisters. In post-mortem putrefaction, there is gas seen, whereas ante-mortem, which is caused due to burns, it is inflammatory fluid. In post-mortem blisters, the base is pale, whereas in ante-mortem, it is reddish. Liquefaction. It occurs earliest in the larynx and trachea. In sequence, it follows stomach, followed by intestine, spleen, liver, brain, and lastly heart. Later, prostate, followed by uterus in non-gravid female and skin. Lastly, to liquefy is bone and tooth. Entomology is defined as the study of insects used to estimate time since death, identification of poison, and place of disposal based on the insect species. The life liquefaction order. Earliest liquefaction is seen in the larynx and trachea, after which early it is seen in the stomach, intestine, spleen, liver, brain, and then heart. Later, it is seen in the prostate in males, uterus in non-gravid females, and skin. Lastly, it is seen in bone and tooth. Entomology is the study of insects used to estimate time since death, helps in identification of poison depending on insects feeding on the body, place of disposal based on insect species. The life cycle, we have eggs followed by larva, pupa, for pupa which grows into a fly, which lays eggs. Adipocere and mummification. These are modified forms of putrefaction. Adipocere formation occurs in warm climate in the presence of moisture in the environment caused due to Clostridium wild-type bacteria, whereas mummification occurs in dry and hot climate. The mechanism of action in adipocere formation, fat is hydrolyzed and hydrogenated to fatty acids, where fatty acids are then converted into a wax-like substance on the body. In mummification, drying and dehydration of the body leading to shrinking of the body, where more than 70% of the body weight is lost. It occurs after 3 weeks to 3 months after death, whereas mummification will take 3 months to 1 year after death. The smell is ammoniacal in adipocere, whereas in mummification, the smell is odorless. It helps in identifying time since death, place of disposal, and helps in both of them also help in time since death and place of disposal. Preservation. Blood is the most reliable viscera preserved. It is collected from the femoral vein. The stomach and its contents are ligated and preserved. The small intestine, proximal 30 centimeters, is preserved. 500 grams from the liver is preserved. Half of each kidney is also preserved. The preservatives used are saturated sodium chloride solution. It is avoided in aconite poisoning and corrosive poisoning, except carbolic acid. Rectified spirit. It is avoided in formalin, phosphorus, and alcohol poisoning. There is no preservative used for bone, hair, nail, teeth, or lung. Formalin is never used as a preservative. In specific poisoning, in strychnine and gelsemium poisoning, spinal cord is preserved. In aconite and digitalis, heart is preserved. In gas poisoning such as carbon monoxide, lungs are preserved. In pesticides, we have adipose tissue is preserved. In carbon monoxide and cyanide poisoning, the spleen is preserved. In barbiturates and alcohol, the brain is preserved. In alcohol poisoning, CSF is preserved along with vitreous humor. Metals, we have bone, hair, and nail is preserved. DNA analysis samples. In a fresh dead body, blood with EDTA preservative is used. In early decomposition, spleen or muscle is used. In advanced decomposition, we have bone, hair, and teeth that is used. Thank you.